Hello everybody, I'm Dr. Joe with Freedom Physical Therapy. Today I want to go through some of the tools we have at Freedom. We have Hyperice products in-house here at Freedom. As a therapist, I use them with patients. We also sell them. Today I'm going to focus on people who have knee pain. Here in Wisconsin, as the weather gets nicer, people are going to start running outside more, biking more, just being more active outside. With the nicer weather, I've seen an uptick in knee pain. A lot of times, knee pain, as we start getting back into activity, is from weakness or tightness in the quads themselves. As the quad weakens or it's tight, it doesn't act as a pulling mechanism on the quad tendon, which sometimes alters the patellar tracking position. So what Aaron's going to do is show a method with a Theragun. It can be done as a patient or by a therapist. I like to always start with the patient using the Theragun. Once I practice on myself to show how to use it, just so they can get a feel for the pressure and the settings that we can use on this Theragun. So this gun has 3 different settings. Right now I'm using the first one just to kind of get the muscle loosened up a little bit and get the tissue ready for what the gun can do. You then can turn it up to setting 2, as well as a 3rd setting. So we're going to use the 2nd setting here, and Aaron's just going to go up and down his quad, staying on the meaty part of your muscle. You don't want to focus on the kneecap itself. As you can see, it's bouncing off and it does not feel great. So we just work up and down, kind of loosening this muscle up. So we'll have Aaron try it on himself too. And there's no right or wrong amount of pressure as long as you can handle what's coming. And we want to focus 2 to 3 minutes, just focusing on some sore areas, working up and down, loosening the entire quad up from the VMO to the vastus lateralis. And Aaron's going to pump it up to the 3rd setting because he wants it a little more intense. We also have different heads for the Theragun that we sell and that we use. We have the prong, which I do like using for the quad as well. They have multiple spots, as well as a little more of a cushioned head. And we also have more of a fine head that gets very precise areas. For me personally, I prefer the flat head or the prong head. I think it works really nice, especially to hit multiple areas at once. So if you're having knee pain, using a Theragun is a great activator as well as recovery tool to loosen up this quad and get it activated before activity. If anybody would like to check one of these out, please visit us here at Freedom Physical Therapy here at Fox Point, as well as our other locations in Grafton, Brookfield, and McGuanago.